everyone. Welcome to this episode of Entrepreneur Showcase Series. I'm your host, Patranya Media. The show is brought to you by Patranya Media LLC and Parkway Media Partners. Today, we have some very special guests joining us on the show, especially as we're heading into the New Year's and the holidays. This is such a great topic. I want to welcome back Dr. Jerry Hu. He's been on the show before. Terrific guy, a founder of Nevada Dental Sleep. Welcome back to the show, Dr. Hu.
Hello, it's so nice to be back. Happy holidays, everyone. I'm excited about today's topic, so thank you for having me. I'm very, very happy to be here today.
So great to have you. And today, aside from you, we brought a patient who has worked with you, a success story that we wanted to share. His name is Bon Anaya. Bon, thank you so much for joining us.
Hello, good morning. Pleasure to be here.
Good morning. And you both look so happy to be here. I'm so great. It's great to see because we're talking about something that has to do with our health. And everybody cares about, obviously, being as healthy as possible as we're going to the New Year's. A lot of people are thinking about the New Year's resolution, wanting to stay healthy. And Dr. Hu, that's kind of been your passion, especially when it comes to losing weight and how that impacts your whole health, right? So talk to us about Nevada Dental Sleep. When did you start this clinic here in Nevada?
So I started here 3 years ago, and you're absolutely right. You know, especially during the holidays, it gets close to that New Year's Day. Have New Year's resolutions, right? So one thing that is really, really important to me, and it's tied to even, these last couple of years, I've lost both my parents, and myself, my own health has all actually had some connection. And this is all in the literature, it's in the evidence-based science about how certain systemic issues have complete root-based cause due to poor quality sleep. And sleep is a third of our lives. It's the basis for so many things, from our energy level to our exercise, to our concentration, to our focus, to all of that. So really, for me, being here is like another one of those really special things, because as long as I'm bringing more awareness and people can understand how they can be to their fullest potential day in and day out by addressing their sleep and their breathing during their sleep. Oxygen is so important, and throughout the night when we recharge, that's the main thing. So it's been a fantastic journey. I know Vegas Valley is going to be maybe even close to 3 million. So I think it's a very, very good thing that we can do to better the world, better the quality of life for people in our community.
So Dr. Hu, briefly explain how kind of that tie, because yes, we hear, when you're looking to lose weight and get healthier, sleep is so important. What's kind of that basic core for people to understand that if you're not getting that, that sleep that you need or the kind of quality sleep, it really impacts, how your health, everyday life and how much you weigh really comes into play.
Yes, and so, with sleep specifically, it's actually the stage of N3 slow wave delta sleep. A lot of things kind of have to, let's just put it this way, kind of recharge or renew or get regulated. And a couple of those hormones related to weight loss are the leptin and ghrelin hormones. They're connected to how much you eat, how easily you're satisfied with the food that you eat. And for example, if you're a stress eater and you're not sleeping well, right, you go through hypoxemia, low oxygen levels throughout the night, your body's going to be actually very, very tired because it's shifted to sympathetic, meaning that it is on fight or flight. If oxygen levels at the hospital go below 90%, a nurse supposed to push a crash cart to you. That's how serious it is, right? And oftentimes when we do these sleep studies and these sleep tests, we get oxygen levels way below that. And it's like a miracle sometimes that people are still alive with those low oxygen levels. But of course, sometimes people don't make it. Even celebrities and people you hear of, when they find that their official cause of death is oxygen deprivation, inducing a heart attack or stroke, etc., it's a very serious issue. So yes, when you have that good quality sleep, and it's the architecture is sound, it's going to make a whole difference right when you wake up, from your energy levels. I got my black belt in karate. I was overweight for the most of my life. I was almost at 380 pounds at one point in my life, right?
Yeah.
And if you were to ask me to go through it was a Okinawan Jin and Ryu karate series, and the endurance test for the brown belt was 4 hours, but the endurance test for the black belt was 8 hours. 8 hours of nonstop ninja crunches, burpees, I mean, and I remember the sensei spitting out my face going, "You want that black belt? You want that black belt?" I'm like, "Yes, sensei. Yes, sensei." And there's just no way I could have done that if I
Yeah. So you
followed
learn it through personal experience that, how crucial it is for you. And you've passed this on now, through your clinic that has been so successful that people actually have been finding your name and your clinic. And among those patients, I want to bring Bon in really quick. Bon Anaya is a Las Vegas resident. Briefly tell us, Bon, what were the challenges you were dealing with health-wise until you found Doctor Who, and that completely changed everything for you?
So, a little bit before I found Doctor Who, I had been struggling with my weight, like a lot. The majority of my life I've been overweight, but I was at my biggest, weighing 440 pounds. And I walked in, and he looked at my charts, did my test, and he was like, "Yo, like, it's a miracle you're breathing, bro."
Wow.
And I'm like, okay, you know what? Like, let me go ahead and, I'll ask all the questions that I need to know, right? Because it's not my realm of expertise at all, So, like an average dude, it's more misinformation than anything,
Right.
And he just told me his personal experience and how, he changed his entire life, and I'm like, I'm ready for that. I'm ready for that, to be honest.
And he was an inspiration to you, right? And when he put you through that process and when you worked with him, was there kind of a light bulb moment that came up, or something that just like, okay, now this is working?
So the first couple of like months, right? Well, actually, no, not even like. So I think the first month was like the weirdest thing, right? Because I had to like, have my mouth guard and like, my nose appliance, and that was a completely different thing because like my body was like not used to all of this like open sightness and breathing correctly and mouth positioning, right? So I mean, other than that, like honestly, like the process by itself was really, really simple.
And Doctor Who, what was your reaction seeing how when he came in and how he is today?
Yeah, well, so two things. First, Bon is one of the most friendliest and positive patients we've seen. My team and myself were just like, wow, this is someone that really actually brings light into the office. And but I also noticed that as I'm going through his sleep study and going through all of the different components, he was very attentive, and it was kind of an emotional connection, if you will. I can see sort of forward, if you will, that if he kind of just follows all the steps, compliance with the appliance, and also, try to make, I told him I'm not an expert nutritionist, I'm not a personal trainer, I'm not any of those things. However, if what I've been through, if he can kind of just see that process, and then after 90 days, we did a post-sleep test, and then after that, several months, 6 months, 12 months, the weight came off, and the energy levels, and it's one of those things that money can't buy. I did not know as a dentist in my life, going in dentistry, you're going to be doing fillings and smiles. You never thought that you would actually be able to impact life. And so I'm very, very grateful that he's part of our office and be able to see his journey and be here today.
Bon, you can look in his face, like Doctor Who said, this guy is a happy guy, right? But tell me, just in the inside, how are you feeling now compared to like a year ago and before you started this process?
So before I started the process, I was falling asleep at work, right? And I actually lost that job because of how bad my sleep apnea was.
Wow.
Like it could be the middle of the workday, and I'm answering a call and then I passed out, and it wasn't like I'm like, oh, you know what, I'm tired, let me go to sleep. It was like okay, the phone's ringing, shut off.
Wow, really?
And I'm like, yeah, that's scary.
Yeah.
Like I had a couple of those situations, where I'm like, you know what, dude, I'm feeling tired, and then, the last thing that I wanted to happen, is like that to happen when I was driving.
Right. Oh, that's
then.
And you're in the car right now. And imagine something like that happen. So what do you want to tell Doctor Who? Like what he's done for you, and what do you want to tell maybe other patients who are looking to maybe get the kind of help that you got from him?
Honestly, thank you. I want to thank him from the bottom of my heart because, instead of, no, 100% thank you. Because instead of just, like giving me a sleep apnea machine, which the insurance has really wanted me to get, he was like, you know what, let's get you on something different that is actually going to work for you.
Right.
So you can breathe with your own strength of your lungs, because I didn't even know that sleep apnea machines eventually, like, you know,
Yes.
like weaken your lungs. And I was like, like it blew my mind,
Right. It's just so amazing to hear stories like this, Doctor Who. I know we don't have a lot of time for this, but I just want you to recap. If people want to get help, people like Bond who thought maybe there's no solution for me, what can they do? How they can reach you and talk to you more about this?
Absolutely. Well, first, if they wanted to get information and call us directly, we're more than happy to help.
Mm-hmm.
A lot of people out there, Bond mentioned about the CPAP machine. The CPAP has a lot of issues that aren't really out there or disclosed or given to the public.
Mm-hmm.
There's a thing about natural breathing, right? Inhalation, exhalation, and there's even an expert in Ireland named Patrick McGowan. He does Buteyko breathing.
Mm-hmm.
These things are part of our rhythmic breathing, all of those. And even when you think about meditation and things like that, and when you have a CPAP machine, it's just forcing air, right? It's a continuous positive airway pressure type of system. And when you have pressures of 7 or above, when that air hits the endothelial cell lining in the lungs, it actually releases angiopoietin-2. Angiopoietin-2 is a marker for increased risk of strokes and heart attacks. So when you're, having those very, very important things, like the machine's supposed to help you survive and help you sleep better, right? But instead, it's increasing the risk of cardiovascular events. That's super important to know. So when patients are CPAP intolerant, they can't use it. Remember, as adults, we're supposed to sleep 7.5 to 8 hours per night, 7 nights a week. So if you're not using your CPAP machine like that, then you really need to think of something that's going to be effective in an alternative. As well as when we do this process, we do bill medical insurance and also Medicare. And we accept all those insurances, but there are steps. We have to get the referral. We have to get the medical letter of necessity. So a patient can start by talking to their primary care physician or just giving us a call. I mean, there's a lot of steps, and we'll be more than happy. What we normally do after their first phone call is we can send an email of a checklist of things to do, because then they can, bill medical insurance.
Well, Nevada Dental Sleep, right? So that is the name of your service, and we want to make sure people find you. There's so much information. I'm sure when Bond started this process, it was overwhelming for him too. But I'm sure as soon as he meet you, Doctor Who, he, found the light, right? Like you got the solution you needed. And this is what we want people to know, especially as they're thinking about the health going into the holidays. Doctor Who is here for you, right here in Las Vegas. So Doctor Who, thank you so much. We're going to put the information on the website and make sure that people find you and get all the help they need. Bond and Naya, congratulations. I'm so happy that you're healthy, you're happy, and you got the help you needed. And this is what it's all about. So thank you so much, Dr. Hu and Bond, for joining us on the show today.
Thank you. Happy holidays.
Happy holidays, everyone. And thank you so much for watching and listening to us here on the Entrepreneur Showcase series. We'll be back next time.